Hello everyone, I am Dr. Mayukh Hazra and welcome back to a new video. So today's video is on INICET master plan. In my previous video, many of you said that, sir, there is lack of clarity. Could you explain in depth how to crack INICET? So today I am going to talk about how to get top 500 rank in INICET. So coming to the INICET exam pattern. So the exam pattern is a bit different from the NEETpg. Though the syllabus is the same, but it's a bit different from the NEETpg because it tests on the basic knowledge more on the concept rather than your clinical analytical skills. Like NEETpg gives you a scenario that in this case what you should do, so you think more as a clinician. But here the basic knowledge of the basic subjects is more important. The concepts are more important than your clinical analytical skills, so it's a bit different. And in INICET, as you know, as I have said also, that the depth is more than the overall hold. So NEETpg is a bit superficial. It goes superficially over many topics, so it sees your hold on the subject. But INICET deals with the depth. I give you an example. Like you all know that it's a INICET PYQ, that which artery goes below the pterian, because in cause of hemorrhage, the extradural hemorrhage, it is due to that artery only. But this time in the November INICET, they asked that which sulcus lies below pterian. Another question was asked that which structure lies below pterian. So like this, they go into the depth of the topic, and many you can't guess also. So you have to take that some questions are going to get wrong, so you should not miss the previous year repeats and the must do questions wrong. So firstly, if you are targeting within 500 rank, you should know that how much correct you should get and how much you should attempt. So I am showing the EIRs. I have got information. They are, most of them are my friends. So I am showing the number of correct. They attempted more than 190 questions only. So you should target to attempt. My senior also told that how many questions you should attempt. That is 187 to 193 questions you should attempt in INICET. This is of November INICET. The stats I am giving is of November INICET. So EIR 35 got 152 corrects. EIR 48 got 150 corrects. This time corrects were a bit low. So you can see the data. So if 160 plus corrects if you get, then you are assured top 20 rank. Though a disclaimer that the number of corrects is not shown in the INICET report card. This is the estimate we get seeing the recall videos and all. So in 160 plus corrects, top 20 rank is more or less guaranteed, and 150 plus correct, top 500 rank is guaranteed. So you should target according to your dream branch. You should target, if you want medicine, then top 100 is required. So 160 plus corrects. If you are dreaming for dermatology, 200 rank is sufficient, I think. 155. And if you are dreaming OBGY, orthopedics and all other clinical streams, so 150 corrects is sufficient. So you should target this score, and you should maintain this score at least 150 plus corrects in your GTs also. So coming to the important subjects, as you know that the basic subjects are the most important for INICET. So approximately 100 marks are asked from the basic 7 subjects only. If we consider FMT, then 110 questions are also asked. So anatomy, super high yield anatomy, physiology, biochemistry, pathology. See, 20 questions approximately come in from pathology, pharmacology, microbiology, ComMed, FMT. Now in the major subjects, high yield are only surgery and OBGY. So the high yield subjects I have marked with the highlighter. Okay, so like this you can see and get an idea that how much important a subject is. Now comes the extra focus, means these topics are not important for NEETpg, but they are asked in the INICET. Okay, so you are preparing for NEETpg. See, NEETpg should be your basic. Your staple food is the NEETpg. Okay, your rice and dal is the NEETpg. The biryani is the INICET, the biryani or pizza. Okay, so staple food you must prepare for that. So in NEETpg you are preparing all topics. Which all extra topics you should focus on, I am giving in INICET extra topics which are more important. If you want to make a separate video on the repeated topics of INICET, I can make a separate video, but in this video if I tell that, it would be very much lengthy. So I am giving the important topics here only, the extra pointers you should focus. So in anatomy, the cadaveric images are more or less asked nowadays. Nowadays, in recent 1 to 2 years, more and more cadaveric images are asked. Neuroanatomy is very important because you know the phonics question and the Therian also I said, those all are neuroanatomy only. So neuroanatomy is very important, and embryology is also important. It's for NEETpg also. In physiology, the graphs are very important. So if you can practice the graphs from Ganong, then it would be great. Now biochemistry, the genetic part is super important. From genetics they ask many questions. Even the human genome project, all the salient features was also asked. They ask you on separation techniques, CRISPR-Cas9, DNA footprinting, DNA walking, and all many things. Patho, as I have said, that 20 questions are asked. So stains, these topics are not asked in NEETpg. Okay, stains, vials, that are important for the intern's perspective, and the blood products, storage of blood, and how to administer, reactions regarding the blood transfusion. These are important. In pharma, extra pointers are the FDA approved drugs you should study. I would provide the site in my Telegram channel, and don't worry about the notes, I would give in my Telegram channel only. So do join my Telegram channel. And monoclonal antibodies, as I have said in my previous video also, and lithium is a focus. Okay, lithium they like very much. As you know that the NIMHANS has also come under INICET, so they focus on neuro a bit more. So lithium is a very important drug. Like they ask the side effects of lithium, which is not a side effect of lithium. After how many days the steady state of concentration is reached in lithium? What is the concentration range of lithium should be kept in therapeutic drug monitoring? After how much time of last dose of lithium the therapeutic drug monitoring should be done, and blood samples should be taken? So these are all the same type of questions are repeated more and more. Okay, in alcoholic, the alcoholic is also very much important. In psychiatry perspective, I am writing, I will write it down. Okay, I have not mentioned it here. So in microbiology, the antimicrobial resistant, the resistant organisms are very much important. The bioterrorism agent are also being asked nowadays. In community medicine, the vectors, the insect vectors are very much important, and you should know the images of the insect vectors. Okay, they give the image and identify the disease this vector is causing. And biostats means all the questions are asked from biostats only. Only one will come from vector and one from another topic. Maybe among 12 questions, 10 are from biostats. Okay, so the graphs you should know, the graphs, the pictorial representation you should know, ABCVD, Kaplan-Meier curve, kappa statistics. These all are the important topics you should know about. Okay, by practicing the PYQ only, you will get an idea of which all things I'm talking about. In forensic medicine, the toxicology part is more important for INICET perspective. In ENT, as you know that in previous 1 to 2 years of INICET, about 6 to 8 questions have been asked from the hearing pathway only. So it is now top trending. I don't know for how many days it would be still trending, but it is till now very much trending as for ENT. In eye, the neuroophthalmology is more important. Medicine more or less means studying medicine won't help you much. Means it is the correlation of the other subjects that's gonna help you. So medicine is not that super yielding subject, I would say, not that high yielding subject. so I have not mentioned about the medicine. In surgery, the trauma, the general surgery part is more important for INICET. The general surgery is very important, and Rohan sir has taught it very well, so you can see his videos. In OBGY, more or less NEETpg and INICET have a bit of overlap, and physiological changes are focused more in INICET. In dermatology, mostly the images are the thing you should remember. Okay, I have not mentioned other subjects. They don't have any such specific, such high yielding topic as of now. So what to do now? Now you have understood what's the funda, how much correct you should get, what are the important topics, which subject has how much weightage, so how to study. Okay, I'm not giving you any kind of revised schedule I used to give, but I think INICET is for high rankers, okay, for high achievers. For high achievers, I should not constrain them with a schedule, okay. Those who find a lack of motivation or lack of strategy, for them the schedule may work out. But for high achievers, they should aim higher, they should aim a better rank than me. So I am no one to guide them that you should follow this routine. So I have not mentioned any study routine. Okay, so what to do now? You should revise, study 4 to 6 hours at least for revision. Means for revision you should keep 4 to 6 hours at least. And in psyche, okay, I have missed it. In psyche, so in psyche, the important is now alcohol related. Okay, delirium tremens, what is the treatment of choice, like in case of alcoholic liver disease, which drug you should give in delirium tremens. So it is love liver, that is the lorazepam, oxazepam. They love the liver, so they are safe in hepatic diseases, they are excreted through renal. And temazepam is also there, so it is a future question. Okay, now what to do? Revise 4 to 6 hours of study should be allotted for revision. Now one good app, no promotions are there in my video, no promotions are there. Okay, so one good app I am mentioning you should study in Pomodoro technique, because here you can see the concentration curve reduces if you study for longer hour. But if you apply Pomodoro of maybe 25 to 1 hour, then as the concentration reduces, you take a 5 minutes break, then your concentration is again at peak, then it decreases, again you take a break, again you study, concentration is high, again you take a break. After that, few such Pomodoro techniques, few such sessions, you take a longer break of maybe half an hour. But don't use the phone, because phone doesn't rest the mind. You should listen to light music, go for a walk around your home only, or do a bit of HIIT you can do. So this app I like, the forest app, because it plants a tree on your each session. Okay, and you can track on which day how much time you have studied. So during my residency, this is the time I got for study, so you can keep a track that how many hour you are giving to study. And there is a background music also that helps you focus more in noisy environment also, because I have my home in a noisy environment, and I also shoot the videos mainly during the night time only, because there's a lot of noise, so it helps to cancel the noise also. So sources, which source you are following is the source you should study. Okay, मतलब अभी मैं कोई सोर्स बोलूँगा उसको चेंज मत करने जाना, बिकॉज इट्स गोना क्रिएट खिचड़ी, एंड खिचड़ी बन जाने के बाद में ना कुछ समेट नहीं पाओगे. So choose what you are following. But if you are not following anything, you can, or if you are following also something, then you can add the first aid. Okay, the first aid graphs are important. The physiology graphs that are asked most are present in the first aid only. Some INICET Nelson syndrome also came, I saw, so that was in first aid only, and it is a very small book, so you can do that. And if you are not having any revision material, then you can go for BTR plus INICET PYT and TND or TND, of dams. Okay, so that is also a good course, I think. Now PYQ. Second comes the previous year question. First was the revision, second is the previous year question solving. As you know, always I tell the golden triangle of success, so following that only the second component of the equilateral golden triangle of success. Practice the 5 years PYQs of INICET and NEETpg. Explanations are a must and wrong answers you should know a must. In previous video I have said that. And if you are having more time, you can go solve the QBank also. The QBank of Marrow and Prepletter. These are the two good platforms with QBank. Okay, I have seen other platforms QBank. I don't feel that they are much great. These two apps spend havoc on their QBank, so they are really great. I feel their QBank is really great. These two apps, if you want to really practice from these two apps, or else don't practice. And 100 MCQs daily. Okay, so 100 MCQs solving, it takes about 1 to 1.5 hours. So 4 to 6 hours of study and 1 to 1.5 years hours of MCQ solving is necessary. Now, as you know, the third pillar, grand test solving. So you should give your grand test, that is the Marrow grand test only you should give, because it has, number one, the largest number of test takers, so your rank tends to be your final rank up to certain extent. And number two is that the questions are framed according to the exam pattern only, and there is very less mistake. I have not seen any mistake in the Marrow GTs. Okay, so you should review the GT, means GT दे देने से ही हो जाएगा ऐसा बात नहीं है कि मेरा अच्छा रैंक आ गया तो वो मैं तो एकदम INICET क्रैक कर दूंगा, मेरे को देखने का ज़रूरत ही नहीं है, या फिर मेरा बहुत कम आ गया मैं तो डिप्रेस्ड हो गया. नहीं, ज़्यादा भी नहीं कम भी नहीं, मूड को ज़्यादा भी नहीं कम भी नहीं. You should take it as a sport and you should review it. Without reviewing the grand test, there is no use of giving the grand test. Okay, so consistently you should give 150 plus corrects. So you can see my GT performance. You can see that before my INICET it was a bit less, 96 percentile. Percentile also, if you are targeting within a top 500 rank, then their percentile tend to be 95% percentile at least. You should target 95. You should give, means 95 to 99 you should be your range if you are targeting for top 500. Because top 10 को अगर छोड़ दो, top 10 में ज़्यादातर और भी ज़्यादा ब्रिलियंट बच्चा होता है, जैसे कि हम लोग यार मेरे टाइम में प्रेम तिलक था, तो ही यूज्ड टू स्टडी अ लॉट एंड ही रेड नेल्सन. आई एम नॉट दैट मच कैपेबिलिटी स्टूडेंट. तो 1000 से जिन लोगों का रैंक होता है ना 1 to 1000, दे हैव मोर और लेस सेम कैपेबिलिटी एक्सेप्ट फ्यू. सो दे हैव मोर और लेस सेम कैपेबिलिटी. दैट इज़ द एग्ज़ाम डे दैट डिसाइड्स. सो नीट में मेरा एग्ज़ाम अच्छा गया तो वहाँ पे रैंक अच्छा आया ज़्यादा, और INICET में मेरा एग्ज़ाम का मतलब एग्ज़ाम डे में थोड़ा सा ख़राब गया, इसीलिए ख़राब आया, और थोड़ा सा एग्ज़ाम स्ट्रेटेजी में भी गड़बड़ हो गया था. लाइक आई डिडेंट स्टडी द FDA approved drugs. आई डिडेंट न्यू the biostats as that well. So your test, the GT performance should be like this, consistent 95 to 99. So you can see my lowest was 95 percentile, 96, 99 mostly consistent. Okay, so 95 to 99 percentile, like this only you have to target if you want to get a top 500 rank, a top 100 rank. So my take on social media, many of you can ask me that sir, how to use the social media, should we completely boycott? So FB I had uninstalled 6 months before my exam when I started preparing seriously. Yeah, FB I thought it was a bit useless, means useful stuff were not seen on FB. YouTube, you could you use YouTube for informative videos, some sessions that are uploaded, free sessions regarding the studies, but not follow those who create a lot of FOMO. और एक ही स्ट्रैटेजी का वीडियो मेरे से भी देख रहे हो और भी बड़े बड़े यूट्यूबर से देख रहे हो, ऐसे मत करो, ठीक है? ऐसे इसके वजह से टाइम वेस्ट हो जाएगा. एक गो वीडियो देखो, मेरा भी सारा वीडियोस देखने का ज़रूरत नहीं है, ये वाला मेन वीडियो है, ये वाला वीडियो देखो, बाकी देखने का ज़रूरत नहीं है INICET के लिए। ओके, ज़्यादा टाइम वेस्ट मत करो, पढ़ने बैठ जाओ। And in Instagram, I think Instagram is useful. Like Insta boosted my preparation, how I'm going to show just below. So you should follow the top coaching institutes. Basically the marrow, the videos and MCQs are great. They are based on the previous year topics only, so you should do that. Marrow and other platforms you should follow, and you can turn on the bell notification also for that particular page only. Then if that particular page posts, then you will get a notification. And yes, notification all off. Okay, all other notification off. No WhatsApp notification, no Facebook notification. Okay, notification should be off because it distracts you. One ringing sound, one tick tick sound distracts you. So like this, Rohan sir posted a question in form of video, so I used to answer like this, like Reynolds phenomena. You can see, you can read the answer also. So I used to means मेरे को ये इंटरेस्ट था। बहुत लोग बोलते थे कि मैं बुक से देख के लिखता हूँ, क्या फ़ायदा है, मतलब आता जाता मेरे को जो बोले मेरे को आता जाता है नहीं। तो मैं करता था कि एक वो क्वेश्चन के ऊपर मैं पूरा एकदम, जैसे मैरो में दिया हुआ रहता है ना एक्सप्लेनेशन, prep ladder क्यू बैंक में, I tried to make that sort of explanation and they asked the relevant topics on it. So I used to write the explanation and I used to post it, and I had a copy in my WhatsApp. I used to type in WhatsApp, so I used to revise those topics because these are high yield topics and likely to be asked in future exams. So this boosted my preparation. I will make a separate video on this also, how to do. Now if you have struggled this much, then you are also going to get featured in this many apps. You are going to get collaborations also. And if you think that I have not used these apps and I've posted in every sort of app like a topper does, but I have used something or the other. Other apps also said for collabo, means said that they want to post my picture, but I denied that I have not used your app. So I had used most of the apps, as you know. And the main thing कि वीडियो ये सब फीचर करना मेन बात नहीं है, मेन बात है दैट यू गेट योर ड्रीम ब्रांच एंड यू वेयर योर स्टेथोस्कोप with a more pride. Wear the stethoscope which you deserve with a more pride, and so that you make your family, your fellow friends proud of you, and enjoy your life. The rank doesn't matter, the institute doesn't matter, nothing matters. Your happiness matters. Your dream branch that you are choosing matters. Okay, at the end of the day, the happiness matters. So all the best. Prepare for the INICET, and as you know that I'm going to make a video soon that a lot of students are going through the stress that the NEETpg is being postponed and many have some mental health issues. So I'm going to address them also because they are an obstacle towards your target. Okay, so if you like the video, do considering subscribing to my channel and stay tuned for more such videos.